Hello, I'm David Harrison, the CEO of the DG Murray Trust. Thank you so much for your willingness to be part of this initiative to bring personal protective equipment and support to community care workers who will be going into people's homes during the course of their work. They include community health workers, emergency services workers, social and relief workers, and child and youth care workers in both the public and non-profit private sectors. Prompted by Eleanor Sisulu, we launched this initiative to ensure that community care workers receive proper protection and support during the peak phase of the COVID-19 epidemic. Our concern was that when it came to the crunch, it would be community-level workers who would not receive the support that they needed. It's the responsibility of government to ensure sufficient PPE to all our public health facilities and schools, as well as to other health workers in public employ. But that still leaves gaps for people employed by NGOs and sometimes even at a local level where government provision may fail. This is where we and you come in to ensure that alongside government, we can keep all our health workers and other community care workers protected. So you're part of a network now of over 300 non-government organizations across South Africa who have committed to identifying community care workers who need PPE and conveying that information to us. The PPE is being procured with the support of the Solidarity Fund and the Elma South Africa Foundation. Coca-Cola and its South African bottlers have kindly agreed to distribute the PPE at no cost to us, while Redisa will provide all the logistics management support. We hope to be able to provide everything that you need within the challenges of procuring PPE at a time of global shortage and high prices. With the support of the Horace W. Goldsmith Foundation, the Charlize Theron Africa Outreach Project, we're able to offer you some funding to cover local logistical costs. Sometimes we may not be able to supply all that you need, or it may come late if the shipments are delayed for any reason. We'll do everything that we can to honor our commitments to you, but ask you to appreciate that we're doing this in very unpredictable times. We think that we may just have enough funding, but our request to you is to use the PPE as wisely as you can. Any wastage means that a community care worker in another locality will miss out. We also know that community care workers need much more than PPE at this time. It's a time of great anxiety for them and for their families. And for this reason, we'd like to work with you to mobilize as much support as we can, both just to have local people who will just be there for them in whatever way makes most sense, but also to try and provide psychological support and even professional care when and if required. The Johnson & Johnson Foundation and the Maitrey Trust have assisted in the funding that's needed for our communications with community care workers, as well as the call center facility that we'll be providing. We'll also be setting up a line to alert us of any impropriety or misuse of PPE. So please don't hesitate to contact DGMT's project manager, Sinazo Nkwelo. You'll receive her details. With the assistance of the Center for Learning and Evaluation Results at WITS, we'll be monitoring our progress and conveying it back to you and to our funders. But what we can do is insignificant compared to what you and your teams do every day on the front line in your communities. We know that you'll all be contributing hugely in terms of your personal time and effort. Most of all, we want you to tell each of your team members, each community care worker, each masked hero, and your families that we value and appreciate them.